there are lots of things in place in the Chinese culture and in the Mediterranean culture and in the Chinese medicine itself that is focused on how can we keep you really well? Because actually, like you said, you do have value. You know, we do see sometimes in society where elderlies are kind of regarded as, oh, you've had your time, you know, and it's not so much that they don't matter, but there's not as much focus on their health and wellness,
Yes.
you know, after a certain age. And in Chinese medicine, you know, there is a big focus on what can we do to preserve or to enliven or to, you know, help with, you know, it doesn't even have to be about, oh, you know, this elderly person is sick and she has cancer. It's more about, oh, she's a little bit out of breath, or she's feeling a bit tired, or, you know, she's, you know, having some issues with her joints and it's finding stiff to get out of bed. And, you know, in a lot of society, Western society, we might see that as, oh, that's normal, she's aging. And in the Chinese culture or Chinese medicine, we would look at it and go, oh, we could actually help with that. We should probably look into why she's stiff at getting out of bed. We should be able to get her moving a little bit better or feeling a bit more well or a bit more energetic. So, you know, it's interesting because I think because I've grown up in it and I am in it, I've never really stopped to think about it. And now that you've asked me that question, I'm like, yeah, I suppose that is definitely a thing.
Is there a cultural acceptance then? Are you saying, given that this is what this tisane or elixir that all of these women culturally move into and start thinking about, are you saying then that in the Chinese culture and in Chinese medicine, instead of it being a taboo, which is only now become fashionable to speak about perimenopause, menopause, even the menstrual years, is it something that, you know, for centuries you
Yeah.
looked at?
So if I mean, this is kind of funny, but maybe not so much to the Asian community, but it's in our culture to just talk about those kind of things. So it's not even it. You know, the funny thing is about these teas, it's not even Chinese medicine in our eyes. It's kind of just something that your mum or your auntie would have mentioned to you. Oh, did you know? You know, you're in your 40s now. You probably should start looking at that tea. So it's just a, you know, it's just a thing that it is in our culture. It's not, we don't even see it as we should start taking that medicine. It's more just like, you should start taking that herbal tea. You should start including that into your diet. You should start looking at this. And it happens from when you're a peewee little child. You're always, you know, get told, Mum, if you're listening, sorry, but, you know, she's constantly nagging me about, oh, you know, you should put socks on your daughter because it's, you know, it's not good for her this, or you should be feeding her this because it's good for that. And so it's constant. It's part of our life. It's part of our culture to just really kind of talk about how to do something better, what's good for your body, what's good for wellness. So the needles that we use, to start off, you know, to sort of talk about that point, the needles that we use in the face, at least in my clinic, are super fine, ultra specialized facial needles. They're a Japanese made needle and there's nothing like them in the world. And they just don't hurt. You pop them in, you wouldn't even know. I always say they should actually rename the word needle. It's not even a needle. I mean, it is, but it is nothing like you would expect it to be. So, because you can use needles to specifically target the neuromuscular junctions in the muscles to get them to do something. So if you've got a muscle that's, say, super tight here because you're constantly frowning and you can feel it's always sore and giving you a headache, you can actually use the facial acupuncture needles to release that. And so your face is automatically more relaxed. And in the opposite direction, if you've got a very droopy muscle, you can actually target that muscle to try and get it to tone up as well.
So can I ask you a question? If I had never had a Chinese medicine consultation, can you talk me through what a consultation would look like? Because I think, you know, many of us have experienced seeing a naturopath possibly, or another functional medicine.
It's
Uh,
quite different. Yeah.
yeah, I'm really curious. I've had a consultation with Dr. Song. I don't know if I had the full consultation, but I would really love for you to share what you can expect in a Chinese medicine consultation.
So it depends on what you're coming in for, but if we're talking about an internal consultation, we look at everything. So we do, you know, truly, this has probably been again a buzzword, but we do look at the body holistically. If you come in for a sinus infection, or you come in with a sore throat, or you come in with, you know, menstrual pain or infertility, we don't look at it as, oh, that's just reproductive system. We look at it as, what's the gut doing? What's what's the blood doing? What's the circulation doing? What's all of that doing? So a lot of it is questions. So we talk like we are talking now, talk, because it helps us paint the bigger picture of what the body is doing. I'll ask you about, what are your bowels doing? How are you going to the toilet? What does your poop look like? What does your tongue look? So there's the tongue diagnosis is a really big part, because the tongue actually shows us a lot about, it's an internal reflection of what's going on.
Yes.
So, the coating on the tongue, if you've got a very thick coating, it almost always means that the digestive system is not clearing. And so it's sort of like that gunk that's sitting on your tongue is the gunk that's sitting in the body. So similarly, we look at the pulse. So we actually take the pulse, and the pulse will tell us a lot about if there's inflammation, there's heat in the body, if there's sluggishness, if there's deficiencies in the body, depending on how fast or how slow, how strong, how weak, how wiry the pulse is. So it's a whole body sort of assessment.
One of the things that I know that people are aware of, but perhaps have not experienced, is that the medicine side of Chinese medicine is herbs.
Mhm.
And a lot of people know that the herbs are like really bitter. Oh my God, have you had,
Not
have heard
always,
about,
but yeah.
yeah. So it's herbs, it's the acupuncture, and are there any other kind of modalities that you use?
Yeah, traditionally, not me personally, but Chinese massage is part of it, because they work on the meridians and the acupuncture, channels in the body. So, essentially like acupressure massage, or we
Yes.
call it tuina.
Yes. And if you've
Gua
ever
sha,
had one
gua
of those
sha.
foot massages, you know you're alive. I mean,
Oh, it's so good.
woo, yeah, it
The only
hurts.
way you should have a massage is if you really feel it. Cupping
Exactly.
is another one. Cupping is sort of part of TCM as well. So TCM stands for traditional Chinese medicine. But I'm a big fan of acupuncture and herbal medicine as the two main, and they are the two main modalities in Chinese medicine.
Yes. So going back to that, does Chinese medicine look at disease and longevity and wellness and beauty through an age lens, or is it a kind of age agnostic medicine, and it looks simply at the concern or the manifestation of the problem?
It's a little bit of both, to be perfectly honest. It will always look at it internally. So the manifestations, the symptoms, the patterns that are happening in the body, how we treat it and how we approach it and what needs to be done about it will sometimes change based on age. So obviously we will treat an infant, a toddler, a child differently to somebody who's going through menopause. So the patterns that we find in the body will be ever changing depending on what your body or the age that you're in. So, going back to that menopause example, if we see a decline, if we see symptoms of a decline in yin in the body, and we look at your age and we go, okay, you're 50, that kind of makes sense. We kind of like, okay, I can see physiologically why that yin is declining. Do we actually want to stop that from happening? No, we can't stop that from happening. Can we support it so that you can ride through menopause? Yes, that's what we would do. Whereas if you were 21 and you came to me and you were showing signs of yin deficiency and decline, and you had a dry mouth and your hair was falling out and your skin was dry and you were hot all the time and you're having hot flushes, would we treat that as a disease or a pattern in the body that we need to fix? Absolutely. We would go in there and we would go acupuncture, herbs, until we brought that yin back up and it was in balance. So that's actually a big one that most of Western society doesn't understand, but is actually a huge concept. And when you can actually get that to click, it's life-changing. I use that word a lot, life-changing, game changer, because it really is. I always use the example of ginger, right? You've got ginger. If you put it in the fridge, if you pick Japanese pickled ginger, if you put that in the fridge and you take it out, it's cold. It's cold to touch, but it is not a cold food. It is a hot food or a warm food, because the property of the ginger is still warming. It is a thermogenic food, right?
Yes.
And similarly to peppermint tea. You make peppermint tea and it's boiling hot to touch, but the property of the peppermint is cooling. So when you drink the hot tea, you still feel cool inside. You got that kind of mentholy.
So we have
sort of
this,
feel.
we have a word, we say sardit kade or garmi kade. Sardi means she's been cooled, and garmi means she's been heated. So
Yep.
if I say to my mum, I've got a headache, she'll, or I feel a bit lethargic, she'll say, oh, sardit kade, which means your temperature has dropped. Go and eat something, not do something. Go and eat something warming.
Yeah, we talk about it as a heatiness. So you might hear that word heatiness is in excessive of yang or excessive of heat, which can cause, a plethora of, symptoms and things like that. So that's a really, really big concept in Chinese medicine, and it ties into everything: longevity, beauty, wellness, preventative, medicine, all of that kind of stuff. A huge, if you were to ask me what's the first biggest and easiest tip to change your lifestyle, it is to try. Your body prefers that thermogenic, that warmth, that warm food in that warm state. So basically just eat more warming food, stay away from cold raw foods that are going to get your body to actually have to continue to fire up more to digest. There's this huge this huge movement around, raw food, which I think is great when you look at it. But it's only one small, very, very small part of the picture. So raw foods, they say, oh, it's got more nutritional content. I can't argue with that. It probably does. And it surely does, sorry. But the second part of it is, but how does your body digest that? If you're putting raw foods in your body all the time, and your digestive fire, in Chinese medicine, we see it, is constantly having to fire up and work harder,